Hi, my name is Dr. Chetan Ginigeri. I'm a pediatric intensivist at Aster Hospital Bangalore. A major concern for most of the working mothers today, especially who leave their children in childcare, is that my child falls sick very often, doctor. And it is causing me to come to you at every month, once or twice. I visit, you give me the same medicines, you keep telling me the same things, but my child doesn't get better. Is there a problem with my child's immunity? So these are major concerns which parents have. So for that we need to first understand why children fall sick very often. First thing, we need to understand that as soon as the child becomes 9 to 12 months of age, whatever immunity is transferred from the mother to the baby, that starts waning off. And the baby's own immune system takes almost 5 to 6 years to mature. And this intervening period is at risk period wherein children are prone to falling sick again and again. In Bangalore, however, we have two major problems. One is recurrent infections and second is allergy. To prevent infections in a child, what we advise parents, first rule is that they should wash their hands well. So hand hygiene is rule number one. They should use soap and water for these children and wash their hands whenever they are using toilets, whenever they come from outdoors, coming back from school. So that will reduce the incidence of infection. Second thing, at least in the months from say June to March, these are the unhealthy months in Bangalore, make sure that your children drink warm water as much as possible. This warm water is going to reduce the viral colonization in the throat, soothe the throat, keep the throat decongested and keep the nose open. Children are compulsive nasal breathers. They can breathe only from the nose. The moment nose block happens and mouth breathing starts, the throat becomes dry, scratchy, and then becomes a nidus for bacteria and virus to proliferate and cause a throat infection. The third thing what we tell the mothers is that keep the nose clean. For that you do something known as hot wet towel. A small towel, wet it in hot water, wring the water and wipe the baby's face and squeeze the nose. This again will keep the nose clean. As long as the child is breathing from his nose, the air gets warm, humidified and filtered. The moment nose breathing stops, mouth breathing starts, children are more prone for infection. So to prevent infection, three basic things: hand hygiene, drink warm water, keep the nose clean by using hot wet towel. The second problem what children face in Bangalore is primarily allergies. And this allergies, the common triggers are dust, especially cement dust and traffic dust. So to keep the dust away from homes, what we tell parents to do is to avoid dry mopping. Don't dry mop your home. This dry mopping will elevate the fine dust and keep it suspended for as long as 6 to 8 hours. So do only wet mopping and do not do dry mopping. If you take care of these things, the child will not have much allergic tendencies. The second thing is, if there are smokers in the home, then you have to stop smoking, or even if you smoke outside, you will have to change your clothes completely before you handle or pick up the child, because the nicotine cigarette particles get attached to your cloth, and even if you're not smoking inside of home, those particles can be inhaled and they completely paralyze the clearing mechanisms of the child's throat and lungs and cause mucus accumulation and repeated cough, cold, fever. So to prevent allergy, one is prevent exposure to dust. Smokers in the home should not smoke inside home. If they are smoking outside, they should change their clothes, clean themselves up before picking up the child. And at home, always do wet mopping, no dry mopping. If you take care of these things, almost 50% of your visits to the hospital reduce in the critical period between 1 year to 3 years, the period in between where you end up sending your child to a baby care or a creche or starting school in nursery or LKG. So that will really help your child avoid hospitalizations.